How to treat and cure sinusitis. Sinusitis is common. But many people who have it use treatments that aren't likely to help. So before you run to the drugstore, you'll want to be sure you know how to handle this condition. The sinuses are small cavities in the skull that are normally filled with air. They make mucus, which helps keep the nasal passages clear of allergens and pollutants. Sinusitis is an inflammation of the tissue that lines these cavities. In some cases, this swelling blocks off the sinuses, trapping mucus and air inside them. This can cause pain and pressure. Sometimes, it can lead to a bacterial infection. Common presenting symptoms of sinusitis include nasal drainage, congestion, facial pain or pressure, headache. Start on one side and progress to both. Thick, purulent or discolored nasal discharge is often thought to indicate bacterial sinusitis, but it also occurs early in viral infections such as the common cold and is not specific to bacterial infection alone. Other nonspecific symptoms include cough, sneezing, fever, tooth pain, most often involving the upper molars, is associated with bacterial sinusitis. Halitosis, offensive breath. Headaches or heaviness of the head is localized to the involved sinus like frontal sinus, pain in the forehead, maxillary, pain in cheekbones etc. It can be worse when the person bends over or lying down. Sphenoid or ethmoid sinus infection can present as severe frontal or retroorbital pain radiating to the occiput. Presence of nasal discharge can differentiate it from toothache, tension headaches or migraine. Acute versus chronic. Acute sinusitis lasts up to 4 weeks. Chronic sinusitis lasts several weeks and can linger for years. Its cause can be hard to pin down and hard to treat. Sinusitis might start because of a cold or allergies. Fungus can cause it for people who have weak immune systems. Sometimes, chronic sinusitis is due to problems with the structure of the nasal passages, or a growth such as a nasal polyp that keeps the sinuses from draining normally. Acute and chronic sinusitis have similar symptoms. Facial pressure and pain. Thick discolored mucus. Congestion. Treatment. The key is to figure out the cause. For instance, if your sinusitis is due to allergies, then decongestants alone will probably not help much. If you have symptoms for more than a couple of days, check in with your doctor. With a good exam and sometimes imaging tests, like X-rays, CT scans, or MRIs, you may be able to figure out exactly what's causing the problem. Often, the best sinusitis treatment is a combination of different approaches, typically medication plus self-care. Surgery. Occasionally, if you have chronic sinusitis or acute sinusitis that keeps coming back, an operation is the best choice. The surgeon can remove blockages and enlarge the sinus passages, which makes it easier for them to drain. Acute sinusitis. Up to 70% of people with acute sinusitis recover without any prescribed medications. If the cause is a bacterial infection, treatment with an antibiotic can shorten the duration of acute sinusitis and can also reduce the severity of symptoms. Other options for treatment include decongestants or nasal sprays might help relieve your symptoms and promote drainage of the infection. Many people find relief by using this sinus saline recipe. Get plenty of rest, and keep your body hydrated by drinking several glasses of water a day. Chronic sinusitis. When treatments or medications fail, endoscopic sinus surgery may be an option. If you are considering having sinus surgery, be sure to weigh the many factors of your condition. This can be a very complex decision and you should seek the opinion of your allergist, immunologist. Surgery should always be viewed as a last resort in children. Before you agree to have sinus surgery performed on your child, consider getting a second opinion from an allergist, immunologist who treats pediatric sinusitis. Home remedies. Apple cider vinegar. Organic apple cider vinegar can be used as both a nasal rinse and nutritional supplement. Taken before or at the onset of a sinus infection, apple cider vinegar delivers a number of nutrients to the body that support overall immune health and prevent infection. Once an infection has developed, the substance can be diluted and used as a rinse to thin mucus almost immediately and to eliminate infection. Cayenne. Cayenne is also effective for treating sinus infections in that it naturally promotes circulation in the body.